A.M.I, Agency for Medical Innovations presents Trilogy. This further development of HAL-RA technology is our solution for effective and gentle treatment of hemorrhoidal diseases. Hemorrhoids are arteriovenous vascular cushions in the area of the sphincter muscle. They are present in every human being and serve, among other things, for continence. The blood flow into the hemorrhoids is via arterial vessels. The number of vessels varies from person to person and their position is different. Hemorrhoids have an important function. They serve as a fine closure and thus, for example, the unintentional escape of bowel movements and wind. Studies show that patients with pathological hemorrhoids have an increased blood flow as a result of the so-called vascular hyperplasia and the associated enlargement of the hemorrhoids. The pressure in the anal canal increases, and disease symptoms such as bleeding and itching occur. If not treated over time and due to mechanical overload, for example when pushing during defecation, a so-called hemorrhoidal prolapse can occur, in which the hemorrhoids come outwards. The suspension structure of the hemorrhoids is damaged. Trilogy and the special developed probe is a compact modular system for minimally invasive and tissue-friendly treatment of the symptoms of hemorrhoidal disease. The treatment method takes into account the preservation of the important function of continence and sensory perception. During the Trilogy development, the handling for the surgeon and the signal quality of the probe have been significantly improved. Modern Bluetooth technology enables wireless, free working. The handle is equipped with 3 high-performance cold LEDs that provide strong and even illumination. After the ultrasound Doppler probe has been completely inserted rectally, the search for arteries begins at a depth of approximately 4 to 6 centimeters. The integrated ultrasound head transmits and receives the Doppler signal at a forward angle. If the ultrasound hits an artery, this is detected. Trilogy is a Doppler ultrasound device that locates the arteries particularly precisely. If the surgeon has located an artery, he can ligate it through the probe to reduce the blood flow. The hemorrhoidal tissue falls easily into the ligature window and can be punctured with the needle near Doppler. As a rule, a double grooving is performed, which is then knotted. By rotating the probe, the surgeon examines the surrounding tissue for further arteries and can set further ligatures accordingly. The method is known as hemorrhoidal artery ligation, or HAL for short, and reduces the blood flow into the hemorrhoids. As a result, the enlarged hemorrhoids shrink and slowly recede. The excess pressure is released, and so are the accompanying symptoms. For higher-grade hemorrhoids with prolapse, the surgeon expands the probe window distally. The prolapsing hemorrhoids fall gradually and in a controlled manner into the window. The surgeon can then use several stitches to set a gathered seam and fix prolapse in the direction of the base stitch. The suture ends approximately 5 to 10 mm proximal to the linea dentata and is thus still in the painless area for the patient. The hemorrhoids shrink back to their original size within a period of 4 to 6 weeks, and the stitches are resorbed. The HAL-RA procedure with Trilogy is a modern and gentle method for treating pathological hemorrhoids with modern Doppler ultrasound technology. The method works in 3 steps. Locate. Locate the arteries. Ligate. Ligature of the arteries. Lift. Lifting the hemorrhoids to their source. Trilogy and the HAL-RA method has many advantages. Effectiveness for low-grade and high-grade hemorrhoids has been proven in many studies worldwide, with low pain and high patient satisfaction. Trilogy, a system from A.M.I, Agency for Medical Innovations.